A very good morning to our amazing lecturer and my fellow classmates. Today we will be presenting on the ethical issue in couples and family therapy. My group consists of five members: Dini Sophia, Gabriel Vinesh, which is me, Serena Annabel, Sumita, and also Vesalan Rao. Okay. Today we are going to see a case study, and there will be a few points presented according to the case study, and then we will also be telling you on what to do in certain situation occurs as a therapy and a counselor, and also the guidelines into family and couples therapy. The first part will be presented by me, which is a case study and a current issue. And then the second part, family violence, will be presented by Serena. The third part, therapeutic neutrality, will be presented by Vesalan Rao. Number four, religion and values, will be presented by Dini. Number five, informed consent, will be presented by Sumita. And the last part, confidentiality, will be presented by me again. Okay, let's get into our case study. What is our current issue? What is our case study? Okay, our case study is actually about a person named Daniel. His effects of alcohol on family relation. Okay. Daniel is a 42-year-old who has been an alcoholic for 28 years. He is married twice and he has a daughter and a stepson. Okay, about Daniel, Daniel has been drinking for 28 years, and then that alcoholism has affected his life. He has become someone who's been hated by his family, his neighbors, and even his own children. Throughout his years, he has been also abusing his parents, who is his mother. He sent her away, and then he also attacked his wife and children due to the influence of alcohol. He wasn't able to work because he was always changing jobs and he couldn't get up early because he stayed up drinking all night. To end all this, he joined a group called Alcoholic Anonymous. They are the ones who actually try to change his life. It was a support group for alcoholics who have been into alcohol for very long years. First, when he started, he felt difficult to cope and also change his habits. And when he sees that his family is suffering, that's when he realized that he has to change. Then he started taking the coping mechanism seriously. And then in that support group, they actually suggested many ways for him to get back to society and then get normal. So Daniel was suggested to make activities involving his family members. He did a lot of activities with them so the children will become more sensitive about his problem. The children were also taught what is alcohol and what is alcoholism and how alcoholic behaves and how to help them. As a part of the program, the children were also called to meet up in the sessions and they were given talk about the knowledge of alcohol. And from there, they get to know what was Daniel's issue. And also at the end of the story, Daniel get to be happy with his family again. So this will be our case study. This is what we want to show. What can the therapy in couples and also family influence and what can it bring forth? And the ethical issues present when you are doing such therapy.
So now for the family violence part. So what is family violence? Family violence, also known as domestic abuse, can take on many forms. It could be physically, psychologically, emotionally, sexually, and economically. And this includes behaviors, and these behaviors are hitting or pushing, which is considered physical abuse, forcing your spouse or family members to perform sexual acts or have sex. This is considered sexual abuse. Calling names and degrading spouse or family members emotionally and or mentally and controlling spouse and family members are considered psychological abuse. Controlling spouses, family members, money, and bank accounts without consent is considered economic abuse. And causing harm and damage to spouses and family members' property intentionally is a form of abuse, and any other behavior that invokes fear in spouse or family members are also considered a behavior of family violence. So, assessment targets. Assessment targets are done for abuse victims and may focus on distal or proximal violence related variables. So, in this case, in Daniel's family, it could be his children and his wife and his mom. So, for the past occurrence, these are considered distal variables, and these include witnessing and or experiencing violence that happened during childhood in a familiar environment, or a recent or ongoing occurrence are considered proximal variables, and these include abuse that happened within the last 6 months as well as ongoing events, which can be considered for Daniel's case. So assessment target focus could be the target individual themselves, so it could be the wife or could be the children. So the individual referred to requested evaluation and individual participating in a study. The abuse perpetrators, in this case Daniel, he could be the target of the assessment because he's the family member that engaged in abusive behavior and display characteristics of abuse. And third-party individuals such as spouse, family members, therapists, and friends. In this case, it could be Daniel's neighbors, in the case where they might have witnessed the abuse going on, as well as the objective records, which is medical records, police records, and court records. So the limitation in family violence assessment. So these skills that are used in assessments are highly selected samples and not random samples, which means that they overlook many non-traditional families and individuals within an ethnic minority. And when this happens, there's a need for cultural and socio-economic considerations. The next part would be the ethical considerations in family violence assessment according to APA's ethical guidelines. Family violence assessment must be done only by qualified individuals who have received special training or possesses special expertise in the said field. The assessor should only use materials and instruments such as psychological tests that they were trained in administering and interpreting. In the case a family violence assessment situation occurs without a qualified individual, the assessor must obtain a consultation from a trained professional or refer the case to another individual who's an expert in the field. Furthermore, family violence assessment must be done based on the most recent and current research studies. When conducting family violence assessments, the client has to be kept safe and harm towards the client must be prevented whenever possible and with informed consent. When making a consideration to break confidentiality and pose risk to the client or any other individuals involved, the assessor has to consider making a decision that prevents or minimizes harm. Moreover, when conducting family violence assessments, regardless of the purpose or the context of the assessment, all reporting laws must be followed. Individuals involved in the assessments must be notified regarding their roles and also when their roles change. The assessor must clarify and stay within their own roles when communicating with other parties regarding the family violence evaluation and should only communicate and cooperate with other parties that will benefit their clients. The assessor must be cautious as to prevent the misuse of power and misunderstanding during family violence assessment, as it could affect the clients and other individuals who are involved. Last but not least, limitations of the assessment data and relevant knowledge in the area must be acknowledged by the assessor.
Today, I'm going to explain about what is therapeutic neutrality and how it's related to our case study. What is therapeutic neutrality? Therapeutic neutrality refers to the therapist's effort to avoid acting on judgment that shows the client behavior during the session or taking sides of the client. Private therapists are supposed to be compassionate, positive, and to speak for the benefits of the client. By this, we can have a best outcome from the therapy session. Importance of the therapeutic neutrality. To prevent by being pulled into a dysfunctional family environment, the therapist must maintain neutrality. Disobeying therapeutic neutrality. If the therapist breaches neutrality by siding with one family member over another, therapy efficiency may be reduced or even lost. Given what seemed to be an obvious recommendation, there is no agreement on how neutrality should be established. Breach of therapeutic neutrality. This part is really related to our case study. A therapist must maintain neutral no matter what, but in due to these two causes, which is child maltreatment or neglect and intimate partner violence, a therapist must not maintain his neutrality and to take an action to report on his client. The first one is child maltreatment or neglect. To be authorized for reimbursement under the Child Abuse Care and Prevention Act, all 50 states must have enacted legislation requiring the reporting of alleged child maltreatment to officials. If a therapist has a reason to suspect that one of their couples is abusing a child, he or she cannot remain impartial and must take action to protect the child. Based on case studies, Daniel, and due to his alcohol obsession, he has abused his child and he has become violent towards his partner. In case of IPV, which is intimate partner violence, a second exception to perceiving neutrality exists. There is a broad range of viewpoints about whether the therapist should even see a couple in this situation, and if so, what requirement should be used to make that decision. A partner of the couple may be victimized at times, and the therapist must intervene to protect him or her. So, Daniel's therapist should take an action and report to his higher position therapist or his senior to make to cause an action to take an action on Daniel. The final option to ensure therapeutic neutrality. The therapist will assert there will be no conflicts of interest as long he or she works for the benefit of the couple. These tend to be the safest way to prevent confrontation and make it an enticing option. The couple's therapy to align himself or herself with one or both partners of the couple at various points during therapy. This method, also known as multipartiality. The client could pursue the therapist's stance of maintaining no alliances at all, declaring allegiance only to achieving the couple's goals. Such absolute neutrality can aid in keeping the emphasis on the issues at hand and achieving better efficiency. So, to make it short, therapeutic neutrality is basically how a therapist should not ever take side unless the two sessions, which is intimate partner violence and child abuse. Other than this, a therapist must maintain his neutrality so his therapy session with his client can have the best outcome and help others.
The next ethical issue in couples and family therapy is religion and values. So, what is religion and values? Starting off with values, it is long held beliefs that one way of life is preferable to another, although it is not always ethical. And religion is when this set of beliefs and experiences are organized into social dogma and practices correlated with organizational memberships. Everyone has different set of values, and oftentimes the therapist and client can find themselves on the opposing side of such values. This can generally be seen when religious values are involved, but more general attitudes can also influence the therapeutic practice. In terms of religious values, therapists must be mindful in their own beliefs as not to influence the client's views on certain matters. This is because some clients, especially those with strong religious background, can have very powerful opinions towards marriage and divorce in general. Thus, similar views can also appear when a therapist is a religious person. In any situation, it is best for the therapist to refrain from imposing their viewpoints and instead address the differences with the clients. Moreover, when the disagreements are proven to be irreconcilable, the therapist can also terminate the sessions and suggest new colleague for the couple. There are several values that can influence in how therapists work within the sessions. The first one is preservation of family, which can be related to Daniel's case. Many times, couples seek therapy for the sole reason of having therapists to endorse their decision to maintain the relationship or to divorce. According to American Association for Marriage and Family Therapy guidelines, the responsibility falls on the couple. However, it is possible that the therapist might offer some implicit cues towards one decision or the other. The cues may come from one's own personal experiences, religious views, or from the unconscious preference for one of the partners. Mixed opinions state that the therapist must impose the couple towards a decision that they feel is right, while some deny their decision regardless of the situation. Hence, it is crucial that the therapist must be aware of their own personal and professional values in pertaining this matter. The second value is extramarital affairs. At the extremes in therapy, the therapist can either approve or explicitly disapprove an extramarital affair for the well-being of their clients. Those who approve it agree that the affair might be beneficial to the client, however detrimental to their partners, while those who disapprove believe that they can work towards helping the clients to terminate the affair. However, there is a possibility that the client might maintain the affair in secrecy, thus jeopardizing the therapist's efforts. Therapists should publicly discuss the issue of extramarital relationships with the couples, solicit their input, and then devise a plan. Lastly, values on sex roles can also influence how therapists work in sessions. In some families, the conventional understanding of sex roles is supported and acceptable, while in other families, one member has more progressive views than the other. Thus, balancing the therapist and client's viewpoints regarding sex roles can be difficult. Families that view sex roles in a traditional manner have trouble in endorsing a progressive separation of the roles as it may lead to frustration from both sides, while families who have progressive views on sex roles may warrant an unwelcome partnership with a discriminated partner. Also, beliefs that women are better suited to take care of children or that a job is more important for the man are sexist. Hence, in order to eradicate the impact of the different values on sex roles, therapists must properly consider his or her beliefs and address them with the clients beforehand.
So, referring to the case study mentioned, where Daniel joined the AA group to help him with this issue, and as part of the program, his children were also called for the meeting and were given a talk and knowledge about alcoholism, and others were going through the same issue. So, an informed consent form is needed and is important as part of any program, therapy, or counseling. So, what is an informed consent form? An informed consent form is agreements or documents signed by clients which are described in ethical codes and regulations for patient, participant, for counseling, therapy, or in research. These materials or documents are provided to clients in a language that they can understand, which includes their rights and obligation, the objective, advantages, risks, standard procedures, the payment system, confidentiality limitation, along with how secrecies are managed, also alternate therapies that are available, and other research materials that are required. These forms are given so that clients are able to make a decision about whether or not to participate in the program, counseling, therapy, or the research. Next, the importance of informed consent. Informed consent form is important as it helps clients to feel motivated, as it offers them with the necessary knowledge and information which helps reduce their dependence on their therapist or counselor, and it also encourages their autonomy. Also, it reduces the possibility of clients being manipulated or being harmed, as this informed consent form, it helps remind them about clear expectation about their responsibilities and roles. It also increases interpersonal relationship with their counselors and or therapists by increasing clients' awareness and knowledge about the therapy or counseling. Thereby, it enhances the procedure and lowers the client's fear and anxiety. Also, it encourages ethical behavior by promoting respect for the client's right to dignity, autonomy, fairness, and honesty. So, when an informed consent form is given in a family or couples therapy, a therapist policy must set out the requirements for couple and family therapy and provide their clients or families with properly completed informed consent process. Also, if only one or few members of the family is interested in the program or therapy, the whole family still has to sign the informed consent as it still involves all members as it is a family and couple therapy or counseling. So the therapist or counselor must provide a concise explanation of what will occur during the therapy program or counseling session and must make this knowledge as widely as possible. Also, when a member of a family shares information during the program or therapy session that may involve another member, the therapist or counselor must ensure that their clients that they are not obliged to share such information or may wish to seek the approval of the other member. However, in situations where children are involved, the parents must have their consent. Next, a client can breach the informed consent form as they do have the freedom to withdraw if they feel uncomfortable or for other reasons such as emergencies where the client's safety or the safety of others is jeopardized, for example, child or domestic abuse or negligence. Also, health and safety, if the therapy induces any health problems such as stress, depression, anxiety, or other health issues which can lead to more tension among the family members. Also for personal reasons such as the death of the loved ones, migration, income losses, marriage, divorce, or career transition. And lastly, non-compliance, when clients who get tired of returning for weekly or regular follow-up sessions due to the duration of the program, counseling, or therapy sessions that they are going to.
Welcome back, guys. It's me again. Okay, now for my topic, I'm going to talk about confidentiality. Okay, for those who doesn't have an idea, what is confidentiality? Confidentiality is actually the law and standard ethical procedure to protect clients' information and data and privacy. Okay, it serves as a guideline for privacy between client and therapist. Okay, confidentiality is when you and your client has your own secrets and also your own private information. That means whatever your client is revealing to you, it has to stay between you and your client unless there is something or there is any importance for you to break your confidentiality. But without the consent of the client, confidentiality shouldn't be broken. Okay, now comes the question. Why is it important? Why is confidentiality important? So we think about it. Okay, first thing, why is it important? Because we want to maintain a safe and healthy client relationship. Okay, client therapist relationship is quite important when it comes to us giving what is best for the client. But maintaining confidentiality will have a lot of trust from the client to us. That means when they know they can trust someone to tell them, to tell their secret or to reveal what's been happening to them, that is the type of relationship a therapist needs with the client so they can fully assess them and also help them. Okay. The next thing, to maintain the privacy of client, clients have a lot of things that they won't tell even their spouse, even their family members. So when they comes to to the therapist or the counselor, we are the one who's supposed to protect their secrets and also their information from the third party. Next, disclosing certain information can result in self-harm and harm to others. Okay, there are certain things that a client keeps a secret to themselves. When we are disclosing that particular information to someone else, we result in embarrassment or also certain times a reveal of their own bad secrets. This can result in them harming themselves or also harming others due to their secrets being out. Next, to maintain the trust between client and therapist. Okay, someone has to trust you to tell you all the truth. That means when they know there is a confidentiality policy between you and your therapist, so the client can always be more truthful and more honest because honesty is what is going to help the client and also help the therapist to help them get better. Okay, when can confidentiality be breached? Okay, this is an interesting question. It is supposed to not be breached because it is something between the client and also the therapist. But when it comes to family and couples therapy, there are certain guidelines that can be breached. Okay. For example, the first one, when there is a threat by the client to others, by the client on themselves or also to others. If let's say we are seeing something like they're going to harm themselves or harm others, that's when you breach your confidentiality. That's when you go for the authority to help you. Next, the evidence of abuse, neglect to elderly, disabled, or most commonly children. When you are in family therapy, there's always the need to work with children. But when you can see if the children are being abused, or if there is elderly in the house or disabled, they are being neglected or they're being abused, that's when we have to contact the authority to let them know that there are people in need of big help. Next, domestic violence in couple therapy. It both works way. It can be by the client or to the client. That means when you are in session with the client, let's say you are in a couple therapy, and then there is two people, and then you get to know that the spouse is actually abusing the other spouse. That's when you get to know you have to take action. Like in our case study, Daniel has been abusing his wife and also his children under the influence of alcohol. So this is the time a therapy should act. This is the time that they should actually go to authority to help them. Next, the last part is required by the law. If let's say you are in a session where you have to give therapy to a criminal and then the law orders you to disclose all the information, that's when there is no confidentiality should be maintained. It can be breached. Okay. Next part. Okay. How can confidentiality be maintained? Okay. There are a few ways that therapists can decide how they want to handle the session entirely. The first part, if it's in a couple therapy, with total discussion, the therapist and client agree to keep no secret. Okay, this is where before the therapy starts, the therapist agree with the client that there will be no secrets kept between both of the spouse, both of the couples, so that there will be nothing which is not disclosed. Every secret will be disclosed. Okay. In this, there is a small problem where any one of the client from the couples could not be very honest or they don't trust the therapist because there will be no secrets maintained. Okay, next, negotiating which information is kept confidential and which is revealed. When it comes to a family, sometimes certain information is best kept secret. Like, for example, having some addiction or having some thoughts of certain things or suspecting of a spouse cheating on them. This kind of information is best kept confidential because if it reveals, it can ruin the family itself. Next, therapy in total control of choosing to reveal confidential information which are critical. For example, when the therapist finds there has been cases of child abuse or having affair or they have addiction or they have other secrets that should be revealed to save the other party. This information should be revealed with great care because these are vital information and the therapist can always choose whether they want to reveal them or not. The last part is when the therapist is being the middle person or the facilitator to reveal or disclose secrets among family members or couples. If let's say there is certain things that has to be disclosed, the therapist can act as a middle person rather than just straight away disclosing. They can act as the middle person and let the other spouse to reveal their secrets by themselves, or even the family members to reveal their secret by themselves. This could save us as therapists or counselors rather than interfering into people's personal life. Okay, we are at the end of our session. For conclusion, couples and family therapy has its own unique guideline because it won't be how we are treating an individual or how we are giving counseling to an individual because when it comes to an individual the matter stays between the therapist and the client itself, but when it comes to the couple and family therapy, couples or family has to be treated as one unit of different people, different individuals. So this is where the guidelines become unique, where normal rules don't apply. Next, the therapists or counselors have to be vigilant and careful on how to handle each case because each and every case, when it comes to couple or family therapy, it is different. Each case is different, each people is different, each individual is different, each family is different. So Some families can have very little children, where it will be a little bit hard to handle. And some families might have teenagers or children who are adults, and it depends on the family and it depends on what type of client you're having. So at the end of the day, no matter what, as a therapist or as a counselor who counsels couples and family therapy, the reward of uniting a family or the reward of solving a family problem is always rewarding. It is always happy to see like how it happens in the movies, like happy ending at the end of the day. That's what is rewarding in this issue. And I would like to say thank you and see you all. Have a nice day, guys. Bye bye.